Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I thank you for joining us today, and I'm your moderator for these sessions. And I'm so pleased to let you know that we have two very special guests with us to talk about the importance of, and the messages of World No Tobacco Day, which is this coming Friday, the 31st of May. We want to concentrate and focus on the importance of raising awareness about tobacco prevention and the harms of vaping and shisha. We're pleased to have with us Carolyn Murray, Director of Tobacco and E-Cigarette Strategy, Center of Population Health from New South Wales Health. Thank you, Carolyn. It's nice to see you again here.
Nice to see you again.
And we have with us Mary Wahhab, Clinical Nurse Consultant of the Sydney Children's Hospital Network, and also the Adolescent Drug and Alcohol Service. Thank you for taking the time to join us today.
Thank you for having me.
Thank you, Mary. And before we start, we'd like to begin by acknowledging the traditional owners and custodians of the land from which we are all meeting from today. Carolyn, Mary, and I are joining from the land of the Caramagal people of the Eora Nation. And we also want to acknowledge and pay respects to elders past and present, and extend respect to Aboriginal elders and colleagues who may be joining us today. And we also acknowledge elders and leaders from multicultural communities and refugee communities who are represented in this session. We'll do our best to answer your questions. Please keep your microphones on mute and tap away on the chat room and ask your questions and also your thoughts. And we will try our best to answer your questions. So we will start. Carolyn and Mary, thank you again for joining us. World No Tobacco Day is a very important day around the world, and especially for us, given what's happening with vaping, smoking, and shisha at the moment. So Carolyn, I wanted to ask, could you tell us what the focus is for this year?
Yeah, thanks, Jess. The focus of World No Tobacco Day, it's every year. It's on the 31st of May. What's important about it is it's an international day, and Australia participates in that. It's to inform the public of the dangers of using tobacco. It also looks into the business practices of tobacco companies and highlights what governments and other organisations are doing around fighting the fight against tobacco and the epidemic of tobacco. The theme this year is protecting children from the tobacco industry's interference.
Thank you so much for that, Carolyn. Are vapes made from tobacco? Let's go straight into it. Are vapes made for tobacco companies? We say here in the banners that you see behind us, no smoking means no vaping. And I guess that means no shisha as well.
Yeah, that's correct. So vaping's seen as the same as tobacco in the legislation. And vapes are made by a range of people, tobacco companies included. And they were originally promoted, as you would be aware, as a smoking cessation tool. But if you've ever seen a vape, the colour, the taste and the flavours, the idea that you can hide them in your hand and those sorts of things, they're really being targeted at young people.
Well, thank you so much for that, Carolyn. Mary, in your work, why is World No Tobacco Day so important as a clinical worker and working with young people?
Yeah, thank you. So World No Tobacco Day is an important day to pause and reflect on the work that has been done, and also look at all the challenges that we are facing at the moment. It is an opportunity to highlight the harmful effects of e-cigarettes, cigarettes, and other tobacco products on a person's overall health and well-being. In the past few years, we have seen an increase in uptake of e-cigarettes among young people. The prevalence of e-cigarette use or vapes threatens decades of progress in tackling tobacco use with its high nicotine content, appealing colours, low cost, and wide availability and discreet designs. Nicotine is an addictive substance and can harm a brain development, and a young person's brain development continues to grow until mid-25. And exposure to nicotine during these important years can harm the brain development that controls attention, memory, mood, impulse control, and can have long-term effects. So as a nurse working with adolescents, I'm seeing the harmful effects of nicotine addiction firsthand. Adolescents and young people have loss of control over their nicotine use, and they do satisfy the criteria for nicotine dependence. And they have difficulty in refraining from nicotine use in places where they're not meant to be vaping or smoking. These would be at schools or hospitals when they come into sessions to see us as well, or when they're in hospital for admission for a medical psychiatric illness. We've seen kids on school suspensions as a result of them having vapes on them and vaping at school. They wake up at night to vape. And they do vape as soon as they wake up because of the withdrawal symptoms and the cravings. And they also report, like physical symptoms where they feel quite breathless when they're walking or engaging in exercise. And that actually, hampers their engagement in physical activity.
And Mary, because they're so small, they could just be taken everywhere and you wouldn't even know that they have it.
Absolutely. Most of my patients actually just tuck it underneath their sleeve and they kind of vape as soon as our heads are turned away.
It's how do you do it? It must be a challenging role, and tell us how an ordinary session would be for you.
Look, it's about engaging with a young person, building rapport, building trust with them, asking them about their e-cigarette use, what they think about them, and also assessing their level of dependency on them, withdrawal symptoms, cravings, finding out what goals they have, what are those harmful effects that they get from them, or the difficulties they have at school. Setting boundaries as well in sessions. The other day I had a patient who was trying to vape, and I, acknowledged that I noticed that this young person was actually doing it in the session. So we negotiated for her to actually put it in somewhere else in the room so that she's not actually enticed to use it during the session. So it is difficult for them to, let go of that. And it's really discreet and, quick, in terms of how often and how quickly they do the hand-mouth motion to actually have puffs on the vapes.
Thank you. And if you have any questions with Mary and Carolyn, please let us know and put them on the chat. Now, Carolyn, earlier this year, we talked about the harms of vaping. And today we want to talk about, with you, the rules about vaping and what people should be aware of. Can you explain some of those key points?
I think it's important to know that when someone vapes, the aerosol that they inhale contains over 200 chemicals. And some of these chemicals have been shown to be harmful to health. So with that basis, I'd like the communities to be aware that any vape that's containing nicotine, whether it's a liquid or a vape itself, are prescription-only medicines. So that means they can only be prescribed by a doctor and supplied in a community pharmacy. So it's illegal for all other retailers, including tobacconists, petrol stations, convenience stores, to sell e-cigarettes containing nicotine. And what we know from a study we did late last year is that the majority of vapes that are available in the community currently are not labelled that they contain nicotine. And that's an important point. So people may not understand that they're vaping nicotine, and retailers may not understand that they're selling vapes with nicotine. But with the testing that we've done, the majority of vapes that are being sold have nicotine in them, and therefore retailers should not be selling them.
There's a penalty.
And there's a penalty. There's a penalty. There's also some prison time or both for selling the products. And I guess the other thing to raise here, Jess, is that no e-cigarette product, no cigarette, no smoking product should be sold to anyone under 18 years of age as well.
So that's really key, right? I mean, we're here today, Multicultural Media members are on the line watching today, and we have health workers. And I guess that's the crucial information, that it is illegal, and that if you don't know, you should be asking. And I guess as a community, what is it that we should be doing?
I think one of the things as a community of, the community of retailers, first of all, I'd encourage them strongly to go onto the New South Wales Health website and have a look at the rules and regulations. We have some fact sheets on there that will support you to manage your business and what you're doing in your business. I think in terms of young people and parents, teachers and carers, it's important that you also go on to Do You Know What You're Vaping resources on our website. because they will show you that there's things that you can do yourself. So whether it's you're the vapor or you're the parent, where you can talk to your children, and things that you can do yourself to quit vaping.
And Mary, with your experience and how about with the knowledge of and attitudes towards the rules of vaping and as well as shisha, what would you recommend and how do you go about it? And you did say that there's these rules when you have these sessions, but what about parents?
Yeah, look, there are some young people that still don't know that it's illegal. So I think, education and passing on that information is really vital to, for them to actually know what they're vaping. And some don't necessarily know that there's nicotine in it or how much nicotine is in those disposable units that they do use. It's really important that, again, we engage with the young person. Also, lucky for me, I get to also work with the parents as well. And so, the parents can also be a great support for the young person to, place some boundaries, to also, support the young person if, we recommend NRTs to manage nicotine replacement therapy, to manage, withdrawal symptoms and cravings. They can also be a source of, trying to kind of help them manage those difficulties when they're feeling irritable or agitated and needing the vape. So they can be a great support for their kids. But also, on the other hand, it's an opportunity for them to also reflect on, their own use of cigarettes or vapes. And I guess that's an opportunity for them to look at what they want to do about their nicotine use as well. So we also support the parents to take, action and, get them to also quit just as much as they want their kids to quit.
I guess it's intergenerational as well.
I think that's an important point, Jess. I mean, one of the things that we recommend around vaping as well to parents is to not vape around their child or smoke around their child, because it is generational. When you see your parent doing it, you see it as an acceptable behaviour. And that's a small thing parents can do to help their kids. Yeah.
Yes, of course. And there's a question here on the chat, and it's saying that I'm a parent myself, and how can I convince my young adult son and his friends to quit vaping? Any tips? Any tips, Mary? And Carolyn?
I think it's good to, engage in conversation with the young person without being negative or judgmental. I think that's really important to, as a actually accepting that sort of banter or that conversation, so that, the information around vaping or cigarette can actually be passed to the young person with ease. So that's a really important, point. Also, just finding out, getting permission from the young person to tell mum or the parent, what they're vaping, and, try and kind of have that conversation around, when they vape, who they vape with, is it hard, trying to kind of get that information from the young person as a way of, engaging with them and getting information so that they can then tell them, well, would you like me to support you or help you in a way of maybe accessing a GP or other support networks to try and quit vapes or the cigarettes. And I guess information is really important. Did you know that there's this much in a nicotine in this vape? Did you know there's this many chemicals in it?
In that small little item that's colorful.
One of the things that is on our website is how many cigarettes in the same sort of level of nicotine equals a vape, and you can have a look at that online. And I think that's important to explain to the young person. I mean, talking to young people can be difficult sometimes, Mary, as you attest. But the other thing that I always love working with young people is that they will tell you exactly what it is you want to know, and they also express that there might be other things going on for them. So other reasons behind why they're vaping, whether or not they're having challenges at school or challenges with perhaps their mental health or some anxiety. And so I think uncovering what else is going on for that young person and how we can support them otherwise.
And there are changes to the laws. It's
There
e-cigarette?
sure are, Jess. So the Australian government is taking strong action to address vaping in Australia. And you may have heard about this in the media. So these reforms will result in significant changes to the regulatory requirements for the importation, manufacture and supply of vapes in Australia, irrespective of whether or not the vapes contain nicotine. The first stages of these have already come into play, including a ban on the importation of all non-therapeutic vapes, including disposable vapes. And this means that people, or so individuals and companies, can only import vapes into Australia when they have approval from the Australian government with a valid permit. And the Australian government has also legislation before Parliament at the moment that will ban the domestic manufacture, supply and advertisement and commercial possession of all non-therapeutic vapes. And this will reinforce those laws I just spoke to as well. So the government's taking this very seriously.
And with your work, Mary, in terms of relating this information, this is crucial information for parents and the young people.
Yeah, absolutely. I think, young people don't necessarily want to disclose where they get their vapes from. They try and kind of, not volunteer that information, worried that they won't be able to access that particular place. So I guess, that worry kind of impacts them because they know that they feel that they can't go without their vape. So I guess in terms of that harm, knowing that I can't go today without my vape is really hard for young people.
Carolyn, shisha smoking, as we said, no smoking means no vaping and no shisha. What are the key things that we should know about this, and how do we go about in terms of the information?
Yeah. I mean, there's some great campaigns around shisha available online. But I guess I want to sort of be clear there's a couple of spaces we can talk about here, Jess. So one of them is the retail space, again, around selling tobacco and non-tobacco smoking products for use in shisha. So retailers need to comply with those rules as well. And again, they're on our website and people can go to the website and have a look at those. So the retailers that have that product have to register their intent to sell these products. They have to ensure that it's also packaged in accordance with the New South Wales laws and contains mandatory health warnings. They can't sell them, as I said before, to those under 18. And the banning of the display and advertising of those products is in place. So those products shouldn't be visible to people from the front of the store or from the front window of the store and those sorts of things. So it's very important as a retailer, I think, to give that the community assurance that it's not on display all the time. So it's not a normalised product in the community. You also, as we said here, with our no smoking means no vaping, that tobacco use and shisha use can't be used in where the no smoking bans are. And this includes enclosed public areas, certain outdoor public areas, and the outdoor commercial dining areas, as well as within 4 metres of an access to a commercial building. So there's a range of rules already around smoking. Those rules apply to vaping and those rules also apply to shisha. So just to make that clear.
Yes, and shisha has been around. It is part of a let's say it. It seems so sexy. It's nice to go and socialize, and that's what people are doing, using it as a socializing activity. And Mary, what would you like to add about shisha? And there are projects that you can see that there are vaping campaigns around from New South Wales Health and Cancer Institute New South Wales, but also the Shisha No Thanks project has been around, and there's a website on the link. So if you have questions, please let us know. But Mary, what would you like to ask, add about shisha? Because it is a different way of tobacco smoking.
Yeah, absolutely. Look, as you know, shisha is a popular, tobacco smoking that is, mostly used by Middle Eastern cultural background. However, what we've seen is that it's actually spread into other communities. We have seen an increase in places where people can actually go and have shisha. So have specific bars, shisha bars or cafes and restaurants with designated areas for smoking shisha. We're also seeing an increased number of corner stores where they actually sell the argile or the hubbly bubbly, as well as other products that go with it as well. And what we're also seeing is, delivery service of shisha to, anywhere that you want. We're definitely seeing a lot of that at parties or other occasions. And it could be a way of socializing. So it's just like, hang out with the boys, for example, hang out with the girls. They might order a shisha. So we're seeing a lot of advertisement as well, in the local area or around. Actually, recently I saw one driving down near the city. So it's not necessarily just in areas where a lot of, people from Middle Eastern background live, but it's actually gone throughout the rest of the communities.
But then, Carolyn, you did say that it is important to highlight that there is nicotine there, that is important to highlight so that people know that it is dangerous and it is harmful.
Yeah, that's right. I mean, the campaign that they've put the link online, a 45-minute session of shisha is approximately 100 cigarettes. And I think if people understood how much nicotine and other chemicals is in that, they may make different choices. And I think what the opportunity here for us is to give people the information. And as I shared before, the New South Wales Health website has a range of information online that can help assist you to understand better and compare the products, for example, and to make those informed decisions.
And I guess it's important to inform people as well that there are services available in New South Wales to help people who do want to quit.
Yeah, I mean, it's a good trigger, the day-to-day to sort of, think about quitting smoking or quitting vaping or quitting shisha. I think it's important to stop and think about your health and the health of others to make those decisions. Talking to your local practitioner, or say your general practitioner, your GP or doctor is a good start. You can also talk to your pharmacist. You can talk to your friends about it as well. I think it's important to have people encouraging you and alongside you to give up these products. They are difficult products to give up, and we acknowledge that. I think what's also important is, though, there's a quit line available, and the quit line is a great service, and we'll put the number on the screen. But it's a great service to have that ongoing support for you. And in talking about ongoing support, there's also apps available for young people around vaping as well, and also quitting smoking. That includes shisha. Yeah.
And Mary, it is as when you do decide to stop smoking, and what are the tips that you can, in terms of withdrawals, because that is part of it. It's trying to quit and withdraw, and how can other people around family members can help support that decision?
Yeah. Look, young people do find it difficult to quit, and often their level of motivation changes, from time to time. And often their peers are vaping, and so it's really hard and challenging for them to actually quit on their own. So that's why it's great, as Carolyn mentioned, to kind of buddy up with someone or friends and think about making the change, because I think that, helping yourself is also, others will help you, and you become more accountable when you're kind of quitting with others, or if you're telling people that you're wanting to quit. The cravings and withdrawal symptoms can be difficult to manage. And yes, there are, it's really hard for them to quit. And these symptoms that they do experience can be a little bit challenging. We do recommend NRTs, although there's no evidence in terms of its effectiveness, but pairing that with behavioural management or contingency management, I think that can be quite helpful. But again, it is about reviewing the effectiveness of the NRTs or the nicotine replacement therapy to tailor the plan or the medication for young people according to their needs. So it's about developing a quit plan. It's about looking at what are the high-risk situations or those difficult situations or triggers to manage, and having those options of long-acting NRTs and short-acting NRTs. It's not going to alleviate all their symptoms, but actually take the edge of it, and at least they can then manage and look at other behavioural management to kind of help them or reduce the stress and cope better. But yeah, I think it's you know, we've got to also remember that young people, you know, do also vape or smoke to relieve some of those anxieties or stress and to cope better. So, you know, thinking about what are those underlying mental health issues that they have, you know, is really important, but also keeping in mind that obviously that would make it worse.
And I think it's important to realize that Quitline is free.
Yeah,
And
it
the
is free.
services and
Yeah.
going to your GP, seeking help is, you know, it's there for you.
Yeah, it is there for you. And I think that's what probably the message we'd like to give to the community, but also the media online, is that the Quitline is there for you. So whether you're a young person or you're a bit older than a young person like me, it's important that you reach out for help. I mean, I think this is one of those addictions of nicotine, which is a difficult one to give up. It can be quite accessible. And as Mary said, there's a range of ways to distract yourself. If you're a young person, you might, you know, go on your phone. If you're an older person, you may go for a walk. Any of those activities that can distract yourself are really important. But doing that plan, Mary, you talked about the plan. And I think if you write down what are those distraction techniques for you and pop it on your fridge, you know, it's there for you when you think, oh, I feel terrible. What can I do now? And you can pick which technique you're going to use for yourself. So those resources are available, and Quitline are there to help you with that.
And also, I guess, about shisha, smoking and socializing, maybe list down activities that you could do instead of doing that.
Yeah, absolutely. I mean, think about, you know, other things to do. I don't know. I'm sure there's lots of things to do.
Maybe go to the movies. Well, you can't shisha in the movies, you know.
Yeah.
Go to a place, I guess, where it's not largely available. Do some exercise with your friends. I hear there's a new running group, which is how you meet people running. You probably can't shisha and probably can't really talk to them either. But anyway, it depends on how fit you are. But I think there are things that you can actually actively engage with in your life that aren't sitting down and socializing around a shisha pipe. It may take a bit of thinking. It may take a bit of encouragement from your friends and your family to think differently about those things. But it's your health, and it's, you know, it's a way of actually making that first step to make that change.
And I guess talking about it. I mean, we've been talking about it now. It's raising that awareness. Education is key to make sure that people know about the legislation, the new changes, that for retailers, they need to know that it's there, that it has to be known that it's harmful, and that people to see that. In terms of, if we are running out of time, but this is really important messaging. And for World No Tobacco Day, as far as I can remember, that campaign is so important. World Health Organization all around the world. But in New South Wales, we've made progress in making sure that there are resources available in languages and for communities.
That's right. So any of the resources we've mentioned today are available in other languages. I think what's important is that you access those and look at the key messages and information in them. Some of the information is quite basic. Some of the information is more complicated, but I think the more you access and the more you read, you'll understand why we think it's a good idea for you to cease and to give up vaping and smoking.
And I'd like to also add, you said, Mary, that for and not just for young people, but for adults as well, people are using these products because they may be going through some things in their lives. So it is important to reach out to people in your family.
Yeah, absolutely. And I guess, you know, again, it's important to see a GP as well, you know, if they've got some, you know, underlying mental health concerns like anxiety or depression. I think it's, you know, talking to someone about it is really important. You know, looking at ways of actually managing stress. You know, like you said, you know, going for walks or, you know, enlisting in some group that you can actually engage in, doing a bit of drawing. There's a lot of different things out there now. But I guess it's kind of like looking at other ways of actually reducing some of that stress and channeling it, you know, somewhere where it's more positive rather than negative, because that's just going to feed back all the negativity and it's going to make things worse. It's not going to make it better.
And I guess as we talked about community and how important it is, you know, we're targeting and raising awareness with multicultural communities, but not being judgmental if someone wanted to quit. I guess, is that something that you would
I think
suggest?
that's important too. I mean, I think what makes it easy to quit is when you're being supported. If that support comes from the Quitline, That's a good idea. If it's family, friends, community, that's also a good idea. And removing yourself from those places where you get reminders or triggers to vape or smoke or have shisha. I think that's probably the first important thing that you can do, is to keep yourself away from those situations for a little while.
Thank you. We've run out of time, but thank you so much. You have all the links on the chat. But Mary, any last words that you'd like to say to our participants online, multicultural media, as well as the health workers and community?
Yeah, I think obviously for your own health and well-being, I think it's important to, act now and, quit. If not now, then when?
Thank you, Mary. And Carolyn, any last words?
We're here to support you. As Mary said, if not now, when? Quitline, your family, your community are here to support you.
And there are resources available in languages, and they're available on the website. So thank you so much, Carolyn and Mary, for being with us today. This recording will be available on the New South Wales Multicultural Health Communications Service website. They'll be shared on our social media platforms. And so there are resources on the website. If you have any questions, please reach out to our service, New South Wales Health and MHCS, and we'll try to help you and link you to the right services. For now, we'll see you in another fortnight. If you have any health topics that you'd like us to focus on, please let us know. And we really appreciate you joining us. Have a great day.